Hi guys, just continuing the questions which we were doing, but again would like to remind you to all the YouTubers, you are 35,000 now, the subscribers. Please press the bell icon so that you get the notifications about OET, NCLEX, German, CBT, DHA. So it's a complete solution for nurses and doctors when it comes to Dr. Bkm. So stay connected with us by pressing the bell icon. More important for you, I'm not saying it in the way of request, neither arrogance nor request. It's just mutual respect for each other. Of course, you will learn something good from this channel and the latest information about nurses and doctors all the time. Okay, coming back to the continuation of the reading. So now we are doing this question. Right. Again, what things I have to consider, I will write it again so that you guys don't forget. Active passive. Can anybody mention in the chat box if I am writing this active passive? Can you see this active passive if I have written this? Can you see this active passive?
Yes, sir.
Okay, good. Active passive. Second thing is modals. Modals means can, could, may, might, should, will, shall. This is also visible.
Yes, sir.
Third important thing was we were discussing about active passive modals. What else, guys? Please help me. Please help me. I have taught you so much. Now I have forgot. Okay. Degrees. Degrees means now what are degrees? Sorry, what are degrees? Good, better, best. I can see this better word over here. This is the first question having degree. Modals, I can see the word may. Modal, I can see the word can. One more instructions was reading questions nicely. This was also one of the instruction we have done today. Degrees, modals, active, passive. What else, guys? What am I forgetting? Prepositions like to, into, before, after, and one more thing. Okay, I will get to know again. Even notice the words like this superior. Then your
Adverbs.
adverbs. Sorry, sir. How can I forget my favorite thing? Thank you so much, sir. Adverbs means majorly ly words, but anything like next, even these words like this superior communication, these are additional words which change the way the sentence appears. Now let us read this question. This is a tough question. I will need your mind to be here again. First, even if it is a tough question, the result. Result means end of the study. Choti choti baatein, small things, tiny. The results of the study described in the memo may explain why. So there is end of the study. That means there would be a research. At the end of the research, the result may explain why something is happening. Okay, let's see what is the end of the result, what is the conclusion. So my answer should be in the conclusion of the study. Okay, memo to staff, women and dementia. Please read this extract from a recent research paper. Research is equal to study. When it comes to OET vocabulary, we have got many videos on this channel. Please watch vocabulary. There are 10 vocabulary videos. I have covered this word repeatedly. Study means research. Research means paper, scientific study. These are same things. Okay. So recent research paper, recent means latest. Even recent word, latest word, these also come under those category with what I call is adverbs. They change the question. So recent study, there was a recent study. Women's superior verbal skills could work against them when it comes to recognizing Alzheimer's disease. Recognizing means diagnosing. In medical professional, when we recognize a disease, means we diagnose. So women's के जो superior skills हैं, they have got superior verbal skills. Wow, women, very nice. Could work against them when it comes to recognizing Alzheimer's. A new study looked at more than 1,300 men and women divided into three groups. One group compromised patient with the amnestic mild cognitive impairment. The second group, including the patient with the Alzheimer's, and the final group, including the healthy controls. One, mild cognitive patients. Second, Alzheimer's. and third, healthy. So there were 3 groups. Okay. So I've just unmuted you. That's why I stopped for a while. Sorry. I was muting you guys because there was new people coming in. So I thought it should create a voice. It should not create a voice. 3 groups divided. Okay. The researchers measured glucose metabolic rates with PET scans. Participants were given immediate and delayed verbal recall tests. So they are talking about the method. So in this line, there is nothing about conclusion. So this paragraph is not that important for me. Again, don't forget the basic. It's not that important because my question is about result of the study. Don't forget this. Then your life will become easy. Women with either no, mild, or moderate problems performed better than men on the verbal memory test. So women performed better. There was no difference in those with advanced elsewhere. This is the conclusion of the study that women performed better. Which women? Which women? Mild, moderate, or no? So they were having mild, moderate problems and they performed well as compared to men. So there is a comparison. Now this is my degree, second degree, good, better, best. This is important for me. Because verbal memory scores are used for diagnosing Alzheimer's, some women may be further along in their condition, in their disease, before they are diagnosed. Because women have superior verbal skills, and these verbal memory scores are used for diagnosing Alzheimer's. That is why some women, again models, may be further along in their disease before they are diagnosed. Before word is also there. So I noticed these kinds of words which I told you. So before women are diagnosed, they are further along means they are already in the advanced stage. So that means women verbal skills are responsible that they are not being diagnosed in the Alzheimer's. This suggests that there is need to have an increased index of suspicion. That means we should suspect women more. Means if there is men and a woman coming, even if woman is performing better, even then I should have more suspicion for the woman. That is what they are saying. And the whole paragraph, if you will say, is about diagnosing or recognizing Alzheimer's. The result in the memo may explain why superior communication skills may protect women. Now I will need your help. Superior communication skills are protecting women or disturbing women from diagnosing? Tell me, guys, are they protecting women?
No.
Superior communication skills in this whole paragraph was causing negative tone. They were causing hindrance in diagnosing Alzheimer's. So we cannot say that superior communication skills are positive things according to this paragraph, because this paragraph is all about diagnosing Alzheimer's, and in each paragraph they were saying superior verbal skills are causing the hindrance, are causing the problem in diagnosing. So this cannot be my answer. Now this elimination makes my things easy. Again, always read the question before each option. The result of the study described in the memo may explain why female dementia sufferers have better verbal skills. Did it say that female dementia sufferers have better verbal skills? No. They generally said that women have better verbal skills. That's why diagnosing becomes difficult. They were not saying that female dementia sufferers have better verbal skills. They were not saying. They were saying they have better verbal skills. That's why they are unable to be diagnosed. So they are not saying that dementia sufferers have better verbal skills. The whole point of this story, now this question is kind of a purpose wala question. The whole point of story was why it is difficult to recognize Alzheimer's in women. That is exactly may explain why mild dementia in the women can remain undiagnosed. That was the whole purpose of this paragraph. This actually was kind of a purpose question because the question had why. Why means what is the purpose of this paragraph? The whole purpose of this paragraph was why it is difficult to recognize or diagnose women with Alzheimer's, because they have better communication skills. So the whole paragraph was explaining why women having better verbal skills, that is what makes difficult in the diagnosis of Alzheimer's. And if you again go by the models, they are further along, that means they reach the advanced stage before they are diagnosed. So they remain undiagnosed. Who? Mild dementia women. Because advanced stage pe to you can recognize after moderate. With the moderate problems perform better than men. So when the women will be in the mild stage, you can't diagnose her. So the whole point of this paragraph was the last paragraph, in which they were talking that women have better verbal skills that makes the diagnosis difficult. So that's why women might remain undiagnosed in the mild stage. This was a tough question. So if I do this reading in the final exam, which we discussed in the last, please guys, I will put the video in the last as well. The video we have recorded before this, who are watching this video. That active passive, all these things. And also, if I say fourth and sixth question were difficult, which I would like to do in the second round. Like this question, I would like to do in the second round. But if you have understanding like me, you can do it in the first round. But normally this question is difficult. I would like to do this in the second round. Saving time is more important. Again, strategy is above the method. What is the strategy? Only easy question first. In the part B, out of the 6 question, maximum 5 question. Otherwise, 4 question will be easy. So, and nobody can do 6 out of 6 questions in the part B in the first round, because otherwise you will take 15 minutes in the part B. You will not be able to finish the paper. We have to complete our part B in the first 10 minutes, in which 4 questions should be right. And 2 will be difficult, which we will do after, like this question. So this is the complete lecture. We will do more questions. I promise you, we will have one more lecture about part B and C. We will not lengthen the lecture, otherwise it will become boring. But please listen to these 2 videos 10 times, 20 times, because we have covered everything. Purpose wala questions. Purpose wala means what is this paragraph about? So the whole paragraph starting from the first line, women are hard to be in recognizing the disease, to the last line. That is why we should have the increased suspicion index for the women, because they cannot be diagnosed in the early stages. So the whole paragraph was about diagnosis. Simple. Then we have talked about everything. Videos I will send you. We will have one more lecture of reading part B and C this week, or otherwise Monday. All done, guys. Any questions, please? I am stopping the recording. Then we'll take your questions. Thank you.